I'm part of a wider speech and language therapy service at the Children's Hospital. My team work with children born with cleft lip and palate. So there's approximately 1 in every 700 babies born in the UK with a cleft palate, and here at the West Midlands Cleft Service we see about 120 referrals per year. It's really useful to have the ultrasound tongue imaging equipment, because traditional speech and language therapy would be just using our ears to kind of interpret exactly what the child is doing, where they're putting their tongue, and then trying to adjust that. Having a visual image that the child can identify with and see, and we can then encourage live and say, put your tongue here, try and touch this, let's look what your tongue's doing. It's really helpful for the children, but actually also for the parents, just to see what we're trying to achieve. I'm going to see Esme today. Esme is 4.5 and was born with a unilateral cleft lip and palate repaired by our service. We noticed that Esme's speech sound were developing a little bit differently, and she had a preference for using sort of the back of her tongue a little bit more. So we've been working with her on speech and language therapy for a little while, and we've recently introduced the ultrasound tongue imaging, which has been really helpful for her and her mum to sort of see what her tongue is doing in real time and to make adjustments. We use a variety of toys, games and activities to encourage her to use the front part of her tongue. We just use it as a bit of encouragement or reward, and then in one of the activities we had what we call minimal pairs, so we'll have key and tea. We want Esme to really use her good t front of mouth sounds to say tea, to feed the monster, and just having that pair there just helps her to really think, I need to use that front part rather than the back part. So it's a lot about kind of having a lot of fun, but also getting the new articulation really established. Being able to illustrate the difference in the tongue position. So when she's using her cur, her tongue is really curled up, and you can really see that image. And what we really need is for it to be a lot more forward and in a completely different position. So when she can see it live, she can really sort of, you know, even just a little prompt, you can just see her directly just changing that as well. The use of ultrasound tongue imaging is relatively new in the world of speech and language therapy, and definitely new into working with children with cleft palate. So we are really grateful to have it here, and grateful to charity funds to allow us to use this equipment with our patients.